Good evening, students. Today we will deal with the Competitive Handbook of Nursing Questions, Volume 2, P.R. Yadav for competition of CHO or AIMS DSSB. As we know that CHO exam has come, so let's have some MCQ questions practice with this book. So firstly, let us deal with some questions which are related with hemophilia. As you know, you can see here the options. I will only say the correct answers. Hemophilia B is the deficiency of factor 9. Then question 215. Which of the following disorder results from deficiency of the factor 8, that is hemophilia A? Hemophilia A is characterized by the deficiency of, the correct answer is factor 8. Drug contraindicated in hemophilia is aspirin. And why aspirin? Because it is an antiplatelet drug and it can increase the chances of bleeding. Then the most common features of a child with hemophilia is bruising. Clinical manifestations. Bruising is the most commonly seen. Then question number 219. Which of the following is not nursing care aspect for a child with hemophilia? These are advised to get circumcised, because all other options are advised to use toothbrush, fingernail, padded clothing. These all options are correct for a general care. Then the next question is, the nurse would expect which abnormal laboratory report into the child with hemophilia? Decreased platelet, increased bleeding time, increased clotting time, increased prothrombin time. The correct answer is clotting time, because in hemophilia, due to deficiency of clotting factor, the process of coagulation prolongs, so increased clotting time will be seen. Then a patient with hemophilia is brought to emergency department after injuring his knee. The nurse should anticipate the need to administer the fresh frozen plasma. The treatment of hemophilia include transfusion of fresh frozen plasma, this is the answer, or concentrate the deficient clotting factor, or administration of desmopressin, synthetic ADH, increased synthesis of clotting factor 8. In this question, it is not clear that the patient have whether hemophilia A, that is clotting factor 8 deficiency, or hemophilia B, clotting factor 9 deficiency, so cannot administer clotting factor 8. So that is why fresh frozen plasma fluid portion 1 unit of human blood has been configured, separated frozen solid within 6 hours of collection. Fresh frozen plasma contain whole clotting factor that are needed for both hemophilia A and B. Then, to control the bleeding in a child with hemophilia, a nurse would expect to give fresh frozen plasma, albumin, factor 8 concentrate, factor second 8, 9, 10. The correct answer is fresh frozen plasma. The following is the most frequent classic site of internal bleeding associated with hemophilia. The correct answer is joint cavities. Bleeding after minor trauma is the hallmark in the hemophilia. Usually bleeding occurs in joints, hemoarthritis, arthrosis, in soft tissues, in urinary tract, intracranial bleeding, and bleeding into deep body sites. These are rare. So we got this, and some kind of questions can also come, like it will ask which of the following instruction is most important when teaching home management of a child with hemophilia? The correct answer is toothbrush should be held under warm water before use. Holding the toothbrush under warm water before use make the brush soft to avoid gum injury. And the last one is a question related with hemophilia is, which of the following is safe game for child with hemophilia? The child with hemophilia will have safe game is swimming. Why swimming? Why not soccer, basketball or field hockey? Why swimming? Because into hemophilia, advised to avoid contact sports activities like basketball, hockey, etc. Advise the patient to promote range of motion exercise to strengthen the muscles around joints to minimize bleeding by range of activity like swimming. That is why swimming is indicated. The next portion is leukemia. We will discuss in next video. Thank you class.